Thank you for joining us for today's webinar. On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Kim Blessing, and I work for Kaufman & Associates. I'll be the moderator for today's webinar. Today's webinar is Panel Discussion, Money Follows the Person, Tribal Initiative, Part 1 of a two-part series. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. We have two panelists with us today and our panel discussion facilitator. Our panelists today are Maureen Woods from the Makah Tribe of Washington and Eve Austin from the Muckleshoot Tribe in Washington. Russell Coker from the Seminole Nation in Oklahoma will be our panel discussion facilitator. Thank you all for joining us today. I will now turn it over to Russell to facilitate today's discussion.
Good afternoon or morning, everyone, depending on where you're at. Welcome to the MFP Tribal Initiative webinar. A little background to begin with. The MFP Tribal Initiative was introduced in 2014. 5 states were awarded MFP Tribal Initiative funds, including Washington State, Minnesota, Oklahoma, North Dakota, and Wisconsin. And since then, 31 tribal nations began coordinating activities across several levels of government, including tribal, state, federal, city, and urban levels. So from the 5-state advisory committee, we developed an overall goal which states to establish sustainable and culturally appropriate long-term services and supports in tribal communities. We've also developed principles, and these are the guiding principles of the MFP Tribal Initiative. Number 1, to promote government-to-government relations, enhance tribal infrastructure, increase access to needed services, address disparities, design and implement effective programs, and maximize fiscal resources. So as I mentioned, the 5 states participating in the MFP Tribal Initiative, just a quick glance at some of the tribes who are participating, and we begin with the state of Minnesota, North Dakota, Oklahoma, Washington State, and Wisconsin. So we will now move into the panel discussion of the MFP Tribal Initiative. But first, before we do have a map that gives you an idea of where the tribes who are participating on the webinar are located. The Makah Tribe and the Muckleshoot Tribe in Washington State up in the northwest corner, and the Wichita and affiliated tribes here in Oklahoma, and also Seminole Nation of Oklahoma, where I'm from. So unfortunately, we were not able to have President Terry Parton, who is president of the Wichita and affiliated tribes here in Oklahoma. We will have her back on a future webinar. So for today's panelists, we have Maureen Woods from the Makah Tribe in Washington, Eve Austin from the Muckleshoot Tribe, also in Washington State. And now we begin the panel discussion. Okay, first question. What has been a success for you in establishing culturally appropriate long-term services and supports in your community thus far?
Yeah, well, MFP-TI is Muckleshoot Elders in-Home Support Services. And it was a program that was created out of a necessity, and there's been community buy-in, tribal support, just to provide urgent home care support needs to elders is how it initiated. And over time, more points were identified, so then it expanded to be support for home care needs for vulnerable adults as well. So for us, that program alone is a big success. The other piece of that is we had some support along the way with Indigenous PAC, a consultant group. And they realized that, we needed some help to find some additional funding for this program as it continued to almost exponentially grow the first 3 years. And we were able to collaborate with the state. And one of the pieces that has been most helpful is we're in our 2nd year of being licensed as a home care entity. So we were able to recapture COPES dollars and also CFC dollars. And COPES is Community Options Program, or Community Options Entry System, and then CFC is Community First Choice. So that allows us to capture some of these dollars for the elderly, so that that can go right back into the program and offset the costs of home care. So to me, that is probably our biggest success, is that there's actually a program helping elders. This program has saved elders' lives, has given them increased time and improved the quality of life of elders and vulnerable adults, so they haven't felt so alone. So I think that has been we're at 5 years strong right now, and we're continuing to grow. And it's been a wonderful blessing to be a part of that story.
So what's been successful is we engage personally with our clients in providing their health care and helping them through the healthcare system. And since we started, we have doubled our client base, and the services proved to be popular and very favorable in the community by word of mouth with our clients and our tribal government.
Next question. What has been your main challenge in establishing your long-term services and support system thus far?
I think for all people, finding out what the costs are is always a challenge. So funding. The cost of our program is substantial. In some cases, one individual might need 24-hour care, and that comes with providing sometimes basically 4.5 to 5 FTEs, depending on what you're doing. And I think for us, balancing Muckleshoot culture, tribal ways of investing in our elders, and then balancing that with state law to be able to have access to Medicaid dollars has been probably the biggest challenge, because for us, we wanted to focus on the tribal sovereignty and develop a program that met the elders' needs first and also upholds state standards. And for us, what's happened is we've exceeded state standards. We're able to do some things that were a hybrid. So not only do we provide home care, we also have two, I would say, social service staff. One is an MSW, one is a specialist. And we are pending 4 RNs, 1 in the educational capacity, 3 in basically surveying everyone, and helps all of our 306 elders with case management as needed, even if they aren't in the program. We really have focused on advocacy, but because of that, our bill is substantial to maintain this, and the tribe has been most generous. But my goal is to reduce the tribal dollars and recapture what's available in the state, because we are providing a service that we can collaborate with the state and leverage all of that. But again, I think that's the biggest challenge, is to find dollars that don't impede us in doing what we need to do to take care of the elders first and the vulnerable adults in our communities.
It's gotten a lot better, but coordinating with our local medical clinic and their staff, because we are our own entity, and so it was kind of a bit of a challenge explaining them what the health home program all entails, comparable to home health, which is totally 2 separate things. And I think that was probably the biggest challenge, was the name of home health and health home. There was a lot of confusion there. So we really had to educate the clinic and our tribal leader officials on the differences between the two. But now we're pretty much on track and have a pretty clear understanding with both.
Next question. What kind of support did you need or are getting to build within your community to make your project successful?
That's a great question. For us, I think that the keystone has been the community support and the tribal council support. In particular, we ended up having several kind of key stakeholders within the tribal council, but I can think of one where she just basically stated that we needed this, and that was the origin point of this program. And there's really ownership that happened by the community and tribal council to launch this program. And getting the right resources, I think the main thing is just focusing dedication on training, doing a target analysis with your tribe. What do you really need? What is really going to support the elders? What is going to help if you're going to incorporate vulnerable adults? For us, vulnerable adults ended up being a piece that just happened along the way. And in time, I sincerely hope to focus a program exclusively on vulnerable adults, just because the needs are different. And I think that, you know, the key thing that you need is taking time to figure out what is truly needed, finding out how you're going to pay for it, and also leveraging as much grant and federal dollars as you can to support the tribe, because ultimately longevity was something that Muckleshoot has committed to for this program, where there are programs that kind of start and then they end as soon as the grant dollars end. And I think that is really essential, is to know what you can, I have a phrase that you want to just kind of start, and you want to be able to hold out for that start the entire duration. So sustainability is really key. So, and I think for us, we've been really blessed with state partners. And again, I will put a plug in for Indigenous PAC. They really helped us meet the right people, and there were some relationships already established within the state, but some of that can be really overwhelming. So I think getting the right resources, meeting the right people in the beginning is really essential. And then again, you're going to have to constantly evolve and change with the tribe's needs and with your elders' needs, and you'll find other areas. So I think the support is just being flexible. Obviously, anyone who's working on LTSS programs, you are nurturer given, and that's one thing that I think is really looking for people that really care. And there are so many people that love their elders, and this is a great way to get them all in one room. This past year, we identified training in-house was like one of our number one goals, and that would be one thing, is really build a community of supportive training. And a lot of people want to learn specific things in our community. We have a lot of caregivers that are community members, and they know exactly what they want to know more about, and then just giving them that mechanism to succeed, I think, is really key. And also making sure that you find out what's already established within your state is essential. And for us, you know, I will just say that we found that doing the training ourselves was really the most important part. And I think that I will say that that's the support that we really needed, and we identified is that we needed to take ownership of our training to do it the Muckleshoot way. That really focused on the cultural component. So, and those are just some pieces, but again, I think it's partnership with your leadership and elders and coming together.
Well, the biggest support was from our tribal council, our leadership, to get this program up and running, and we still need their support. And then we needed our support of our advisory committee with our senior program, and also the continued support with the outside agencies, DSHS and Olympic Area on Aging, local hospitals. We needed their support in long-term care facilities. It's just really important that networking with other tribes is essential too. And we're in working with them, they would like to start up health home programs as well. So it's been pretty successful.
Next question. What would you like to share about working with state and AAA partners for those who have not had previous experience working with tribal nations or understanding American Indian history and culture?
Well, I think there's a long history. Some some good, but a lot has been some negative. But here in Washington, we really have a lot of people focusing on developing rapport and friendships. And instead of tribes being divided, we're actually seeing a lot of unity between tribes and the state. And I think one of the most beautiful things is we've at Muckleshoot had a couple, I'm just going to kind of call them pathfinders that have had a heart and a passion on kind of all sides. We've had other tribal leaders from other tribes really take a huge piece in Washington to collaborate. We've had a lot of individuals with passion and heart in the state, our tribal liaisons. In my time, I've seen Ann Dahl, Marietta Bulba, and we also have an individual, and they are on the state level, and they've literally reached down and helped us develop relationships. But prior to that, we just had a very spirited case manager who would be on the kind of the AAA level, who just loved the tribe and has continually helped us advocate and has partnered with tribal leaders, I will say probably almost for 18 years. So there's been some people who have just literally blazed a path that has made relationships happen by their consistency and hard work ethic. And I think we're seeing so much more of that collaboration and healing happening. So for us, for our partners, I have an actual version of a AAA a state worker who is in my office twice a week and helps with the case management, initiating care for a lot of our elders. And he knows the state inside and out, and that's been a huge leg up for us. And then again, at the state level, we have a tribal liaison department that has essentially helped us tribes come together and share information. We have a quarterly meeting that has been a game changer, just to see what the rest of us are doing and partnering together, and idea sharing that's happened, and email exchanges that are able to happen. It's been a game changer. And we also have summits that have happened on a consistent basis where the state has brought us all together and we learn what's available. And I think that information sharing, face-to-face sharing is really important. So again, I think we and I hope every state is like this, that they have a Keith Rapez and an Ann Dahl and a Marietta Bulba, because you really need those people. They're a source of encouragement and just information. If they don't know the answer, they find it. And that has been a great guide and support to get us on the right path and to even navigate the right questions. So again, we've had and have been blessed by some really key, wonderful pathfinders.
So I think it's really important for outside agencies to know the tribes that they're working with, know what their treaty is, and how their government operates, because each one of our tribes work differently. And so once you have a clear understanding, go online if you have to, Google us, how different each tribe is, learn that tribe that you're working with, and it's just really important of cultural awareness and how tribes are individually different.
Next question. What are some of the challenges when working with states and AAAs when determining eligibility for services?
It can be a maze and confusing. I am not going to deny any of the challenges that we have and continue to have. There are things where sometimes we find out information after the thought process. But as a whole, I think the main thing is communication and a willingness to help tribes succeed. Again, the intention of, I think, everyone is just to do the right thing. And oftentimes tribes don't know all the information that is necessary. And having again, a AAA that is really willing to work with you. And I know we have in Yakima, they have their own tribal AAA. And there are things that tribes can do and assess to figure out what is best for them. And I think that the states in general just want to help tribes do that. But again, we are really fortunate with Washington State really rallies to support Muckleshoot and all the tribes in Washington. And ULSA has been really helpful in helping us navigate this. And again, Keith and Ann have been paramount and just reminding with key information of, hey, do you want to look in this? There's some additional funding here. We might not be able to do this, but if you try it this way, and that has helped us. So there's been a bit of trial and error, but at the end of it, the product that we have right now is something that I'm really proud for the community, in that the community needed it, and there's all there's to that. So, but I think you need dedicated and almost ambassadors to help connect the dots.
I think one of the biggest challenges is building that trust and having a clear understanding of who we are, what we're about, and I think in order to get on into the health home program, you have to have a score for Medicaid to enter in, and I think that's a big challenge because the score is a little bit too high, and we're seeing the need that for some of our people that don't even go into the hospital, and that's how they determine their PRISM score. And I think if the state understood that a lot of our people don't go into the doctors and they still have that need of services, even though we provide those services anyways, it would just be easier if we could enter them all into the health home program.
Next question. If you had a magic wand and could immediately change anything you wanted to improve services for Native people, what would it be and why?
I think I would first wave the magic wand for no bias in healthcare. The second thing is there's a lot of work that has been done. I hope to see more work where tribes are actually seen almost to the state level in some of the decision making because they are sovereign entities, kind of a state within a state. And so I hope to see some additional strength and growth in that, where CMS will actually treat them very similar to the state. I think that would be a great thing, especially in healthcare. And there are areas that is already in place with Indian Health Services. But I think there's some additional growth that can happen there. But I think the main thing that I would change is it's just kind of people's perspectives of what tribal health is and how vital it is and how important, and how people are underrepresented in healthcare. And healthcare is terrifying for just about anyone now because it's very confusing with insurance and all those pieces. But then when you actually get into the room, depending on the practitioner and kind of the prevailing thought in that community, there can be barriers that I've witnessed our nurses really advocating individually on that one-to-one basis, where something would have been overlooked if an elder, tribal elder, went on their own. I think that advocacy is one thing that I would love to see, not only for Muckleshoot elders, but for all Native elders, that they have that healthcare advocacy. I think there's a need.
I guess that would be it, being able to provide services to all our people. Because
all right, perfect.
At some point, they're all going to need that guidance as we grow older.
So in our work with the MFP Tribal Initiative, one point to remember is that there are over 570 federally recognized tribes within the nation. and each tribe has their unique customs, traditions, culture, and history. It is hoped that the work and efforts put forth in this initiative from and by the participating states and tribes, we're hoping that our work can be replicated by other tribes who are wanting to further provide long-term services and supports for the tribal communities and members. And if you would like to get in touch with any of the 5 state contacts for the MFP Tribal Initiative, here is their contact information. And in closing, I say, Mado, thank you to all for attending this webinar.
I would like to thank our presenters for joining us today and sharing information about how our panelists and their communities are implementing services for home and community-based care through the Money Follows the Person Tribal Initiative. Thank you again for joining today's webinar. Our session is now concluded.